So we are recording. Today's community focus is on community service awareness and navigation. And this week we have selected as a special guest, Mike Mikulik from the United Way. So Mike is the Vice President of Community Impact. Here, we can all see him. Thank you. So Mike is the Vice President of Community Impact with United Way of Halton and Hamilton, very passionate about the movement and its capacity to invest transformative community-led change. Mike holds a PhD from McMaster University and is an adjunct professor in Sustainable Futures Program Sustainable Futures Program at McMaster University. He's also the author of the book, The Politics of the Pantry, Stories, Food, and Social Change, and has previously worked as a municipal grant manager, urban agriculture consultant, and founder and co-owner of Common Ground Teaching Farm, an environmentally focused microfarm that teaches folks how to cook, grow, and sustain themselves on the planet through nourishing food. On a personal level, he's passionate about community, bringing people together. He's a backcountry camper, gardener, cook, triathlete, and family man with two beautiful daughters, I'm sure. Mike, thank you so much for joining us today. So what we do each week, folks, is we try to address at least 3 questions over the topics that we are addressing. So for this week, our first question regarding community service awareness and navigation is, what community services are available to Oakville residents through the pathway of taxation? I do recognize one of the names in our attendees today, Councillor Robertson. So you can correct me if I'm speaking on anything incorrect in regards to service allocation through taxation, because I know this is much more appropriately your area as a paid elected official. So I'm just going to stop sharing so we can see each other here, and I will speak to Nabeel. Are you comfortable if I kick it off?
I'll allow it.
Okay, perfect. So in terms of the services that are available to folks through taxation, I'd like to think and explain this. And Nabeel and I travel to different high schools in Oakville to explain to its civics classes about sort of the navigation of public services. So primarily in Oakville, we look at 4 tiers of government: your federal government, provincial government, regional government, and then local municipal. So on a broad sense, and these are generic to sort of Oakville statistics as a whole, but federal government receives about 53% of all tax dollars collected from Ontario families. Next, we look at the provincial government, looking at about 37% of taxation collected, and then the regional, local municipal government, about 10% of taxes collected. Now, in terms of what those areas of government provide, the federal government naturally looking at broader federal services, things like national protection, environmental issues, global trade, broad issues. As we look towards provincial government, it's administration of justice, social services, education, hospitals. Regional government, that's when we look at more like the delivery of some of those services. So you'll recognize things like Halton Police Department or Halton Police Services or Halton Catholic School Board, Halton District School Board. So really at the level of distribution of social services. And then looking to our local municipal governments and the way we distribute as a 2-tier municipality. So that 10% market share of taxation dollars, we divide in Oakville as either the tier of the region or the lower tier local municipal government of Oakville. Whereas Oakville, we are looking at things like roads and parks, fire response, community centers, community services. Easy way to describe it, which is generic, but it's infrastructure services, whereas the region looks more at social service and human services. Now, buried in those obviously is lots of different, cabinets and different departments and commissions, but essentially as it trickles down to service, depending on what the main issue is, each level of government takes responsibility for, those services. So when we look at Nabeel and myself working in our local municipal government, we're looking at some of those infrastructure services, physical services that we can provide only to residents in Oakville, traditionally for us through our community centers and through our recreation programs. We tend to work really closely and collaboratively with our regional partners because we are servicing really the same caption of folks. We know now, obviously, since COVID-19, which has sort of sparked the reason why we have these conversations, we are seeing more and more people requiring access to these public services. And, in the past weeks of Community Corner, we have really sort of, pulled at different issues that are resulting people in needing public intervention, right? We've looked at overrepresentation of Black communities and the negative impact of COVID-19. We've looked at the negative impact on inclusion for folks with developmental and physical disabilities. We've looked at the continued marginalization and overrepresentation of negative impacts on Indigenous communities. So we have all these people now coming to utilize public services, and there is a lot available. Things like we have 2 welfare systems within Oakville to access a regular income with Ontario Works or ODSP. So there is way to maintain sort of an income for your household if you are unable to do so yourself. We have assistance through public housing. We have assistance through our education and healthcare system. However, the next sort of question, which I'll let Mike merge into, is the public sector does not cover all human needs that folks may have in Oakville. And I would encourage, if anyone is listening and they're not sure of where their needs or where to advocate to for the improvement of some of these deliverable services, is certainly you can connect with Nabeel and I, but there's also just a really easy number of 311. So 311 is basically for Oakville residents, it's the basically 911 of accessing social services. So there's always someone available to be able to navigate you towards what you're looking for. So if you have concerns about your health, about your education, about your safety, your security to food, you can call 311 and they can navigate you. Nabeel, is there anything else you wanted to say from a public services sector?
Yeah, thank you, Daniel. I think that was quite comprehensive, and I think the focus of this program is not necessarily to go into the intricate details of how the bureaucracy or the institutional workings of government is at play, but it's important to identify that when people pay taxes, that government such as ourselves should be held accountable to a certain standard. What's really important also is that taxation should be looked at as a collective process, right? So it's not that I pay X amount of taxes, so I demand this level of service, whereas somebody else doesn't pay the same number of taxes or same amount of taxes. Therefore, they need to experience a lower tier of service. Living in a welfare state, we understand that taxation is a collective good. It's a process by which we make available to individuals, especially when COVID is happening in front of us and we see the needs for social services, community services increased, that more so than ever, that as a municipality, as nonprofit organizations, that we do our part to provide that layer or level of service to the community. But at the same time, the community understands that it is a collective process, right? So it is the reason why we're having this conversation is to have the residents understand from their perspective that taxation means accountability, but it also means a collective good that comes from it. And sometimes municipalities, provincial governments, federal governments can't always address everything that a community experiences, and that's why we have Mike here today from United Way to speak to his experience as to what are those gaps and how essentially can he fill those gaps in the services that are not captured through what I would say taxation or government federal services or municipal services. So Mike, what do you think?
Yeah, thank you. Thank you for having me here today. And I'm happy to talk about these things. And I think, yeah, this is a really great example of the way in which the nonprofit sector and government really have to work together to fill in those gaps. I think a lot of people, they know the United Way, they know what we do, they know we fundraise money. But I think a lot of people don't realize that nationally, United Ways are actually the second largest funder of social services next to government. It's a huge footprint and one that has become increasingly important during COVID. We recently were the sort of partner of choice with the federal government around distribution of the Emergency Community Relief Fund. So this is a $350 million stream of funds that were going out. And the reason that the United Ways were chosen along with Community Foundations of Canada is because it is difficult to mobilize that kind of money and resources effectively in a very short period of time into the nonprofit sector in a way that allows for organizations to respond to this crisis, right? And so I think there's that sort of, we've seen so many disruptions. We've seen so many disruptions in the last little while about, in terms of the services that are being provided. When it came to March and everything shut down, we had a lot of charities and nonprofits that were already stretched thin. Let's be honest, right? They were already stretched thin, and many of them, haven't replaced their computers for a long time. Many of them were working on sort of skeleton staffs, and then all of a sudden they had to go and boom, change their entire service delivery model, purchase PPE, really sort of do this in things that would have normally taken years. And so, United Way and sort of other charities are super important in providing some of the gap funding for some of these pieces, and to be able to fill in some of those things. So one of the things, for example, we of course we fundraise millions of dollars every year and invest in across Halton and Hamilton over 125 different programs. And this is everything from, children after school supports to mental health and crisis lines to food security, really spanning all of those different things. But we're also really looking at how to collaborate with some of our other partners and other funders to fill in those gaps really strategically. So there's just certain things that governments can't fund because of their mandates. There's certain things that maybe they need help de-risking, right? So they might need to be able to sort of say, okay, well, we can fund some of this, but not all of it, because we want to have a kind of consortium. And so we play a really important role, in addition to sort of doing the research, figuring out what is needed and where to put that money. We help in those kinds of partnership elements around how to sort of deliver those services in a way that is maybe a little bit more nimble than sometimes government can be.
Yeah, Mike, and I appreciate you saying that, because so from working passive myself in the nonprofit sector, there's a very different experience of being an employee in the nonprofit sector versus the public sector. It is expensive to operate public level of systems. There's an expectation among those services that is set so high because it is raised through taxation and through elected officials and voting, that the quality of those services is high, but the expectation of the public on those services is immensely high. And the amount of attention change in policy gets from people is so huge that the flexibility and malleability of the nonprofit sector is often a way which we can see the fastest social change, right? So obviously, like you can make change with your vote, but you can also make change with your contribution to your local community organizations, right? Like if something like food security is an important issue for you and your family, like while it's important that you go select, local councilors, regional councilors, MPs, and to make those changes, ultimately, contributing dollars towards Food for Life, or alternatively the United Way. And for folks that are listening, so United Way essentially it serves as almost a curator, purveyor of local need, whereby rather than me having to decide that I want to donate to to Food for Life, I can donate to United Way, and then United Way, having those hosts of funds, can trickle those down into the organizations that would most benefit from it, right?
Yeah. And that's crucially, I think, that's one of the things that, because we often get that question. It's like, well, why donate? If your interest is food security, why not donate directly to the food bank? And I think one of the things that we sort of pride ourselves on as an organization is that we're really sort of looking at that network of support. So it's very rare that an individual who is accessing one service isn't also accessing another one, right?
Correct. Yeah.
And so if you're going to a food bank, you're often potentially using, some mental health supports. Maybe you're using an after-school program. Like there's probably a number of different things. And so what we do, in addition to sort of providing that direct financial support, is what we're trying to do is play that system level coordinator to say, hey, what's going on behind the scenes? What are the needs? Where do we need to invest? How can that, how does that need to change? And really find ways to be really strategic about that sort of big picture. And I think that's one of the big benefits of investing in a larger organization like the United Way, is that, yes, it's maybe not going, that your dollar isn't going to that food bank, but your dollar is supporting that kind of that wraparound service that allows that individual to get the supports that they need. And crucially, again, in partnership with government and with other organizations, because I think all of us are part of that kind of social service ecosystem that
Yeah.
that be there to catch people when they fall. And right now, I mean, I think all of us have heard some of the statistics around, you know, Oakville is known as being a very wealthy place, but I think a lot of people, it's also an expensive place. And a lot of people are living right at that line, right? And so we are certainly seeing in our stats that need is increasing. People who were maybe just getting by, they drop their hours, or all of a sudden things change, and then they are now accessing those services that they were once perhaps donating to support.
Yeah.
Right. So, Mike, what I'm hearing is that the United Way as almost like a foundation where they're able to um, provide some level of holistic or wraparound support is critically important. Making that conversation much more localized to like a municipal service or services available in Oakville. I know oftentimes, you know, in the town's recreation and culture department, we have a subsidy program for low income families. But just like you had mentioned, right? Like how can you just because a program is available, is it accessible, right? And I think that's where conversations around how can municipalities, governments, and nonprofits really come together, and maybe United Way is that conduit, right? Like I know when somebody is accessing, for example, like something as simple as sports, right? Access to play should be made available to anybody, right? But access to play means that you need to have equipment to make those, you know, to play in those spaces and facilities, right? Like is United Way, like what are some of the initiatives that you guys have launched that sort of addresses those gaps and at the same time works with, you know, your municipal partners or your other community partners?
Yeah, no, I mean, it's a great question. And I think we try to sort of take a multi-pronged approach with this. So, you know, we're often involved in a lot of these kind of community tables that are coordinating these pieces. So we're sort of often either part of or leading these kinds of groups. So we're in there and we're saying, okay, the services that are being provided, you know, how are people accessing these things? And one of the things that we've done recently in the last couple of years is focused in on kind of taking a bit of a design thinking approach. So keeping the client at the very center. So imagining the journey of that client and how they're accessing those programs and what are some of the barriers that they might face as a result of that. You know, I think a lot of us, you know, we've all experienced the kind of frustrations that can happen when there's friction in some sort of process. So when something is put in front of you and it's stopping you from getting what you want, it can be really detrimental and really sort of and even small amounts of friction matter. And when you're in a situation where you're facing extreme stress because of poverty, or you're, you know, you don't know where your next meal is going to come from, that actually like ramps up even more. And so one of the examples, for example, in Oakville, we were involved in, or we are involved in a really cool program called the Financial Empowerment and Problem Solving Initiative out of Oak Park Neighborhood Center. And that one on the surface seems really simple. It's a tax filing initiative, right? And the idea behind it is that people who are in low income often actually don't have to file their taxes. If you don't owe any money, you don't have to file your taxes. And so a lot of people, again, because it's one of those stressful things that are often sometimes expensive, are not filing their taxes. But what happens as a result of that? Well, for a lot of these people, they're missing out on thousands and thousands and thousands of dollars of benefits. Their child tax benefits, their Trillium, their rent, all of these kinds of things. So this is dollars in their pockets. This is money that they can be using for services, for supporting their children. But, you know, and so that in itself, a really important service. But one of the things that we've done as an organization is we've recognized, well, we actually have to step back from that and we have to ask why. Like this seems, on the surface, this seems like the most, like, why wouldn't people apply? They literally will get thousands of dollars in their pocket. So what's stopping them? And I think we've taken it upon ourselves to really say, okay, what can we learn from this? And how can we take sort of really interesting approaches like behavioral insights and behavioral economics to kind of meet people where they're at and recognize that those barriers, it's not because people are lazy, that they don't want to, that, you know, it's because these barriers really matter disproportionately when you're stressed. And it is our job to be able to reduce those barriers as much as possible and to begin to test that out. So we're bringing that as a kind of a capacity building piece to the broader section about how to simplify processes, how to solicit people's responses, how to do all these like little tweaks that then can be applied to other nonprofits so that when they're building out their programs, they really keep that client at the center. And so we can get those kinds of that fluid access to those services.
So
That's Sorry, Daniel, go ahead.
No, I was just gonna, I'm noticing this 12:22, so we have about 10 minutes left. So I want to, I know there's four folks that are joining us from community. So is there any questions regarding the two things we've sort of talked about so far regarding, public services available through the public stream of taxation, or even sort of an understanding through how the nonprofit sector sort of captures those services or provides those services that aren't really captured by the public sector? Any questions for Mike even? Hearing none, I guess I get to ask more. So Mike, I was hoping we might have maybe a few minutes before we get into our last question, just to discuss the concept of social prescription.
Yes.
So for those of you who are, who are either watching the recorded or this live version, I want Mike to be able to sell this social prescription piece, because to me it sounds really, really interesting, which in effect is, if you didn't feel well, you would go to the doctor and they would prescribe some sort of, solution for you. However, from a social services lens, there are so many things that could be of benefit, which could also be prescribed to you. But Mike, I'll let you make that sale, man.
Hey, sorry, Mike, I apologize. There's just a question from Sheena about, is there a directory of services that's available? So I know we have the Oakville Public Library, and Marcus does a fantastic job with the Halton database, Halton information database. So that is definitely available, and we'll put a link for that below for you in the chat box. So just wanted to address that before moving forward. Mike, please go ahead.
Yeah, so I think social prescription is another great example of one of the ways in which like government and nonprofits really need to be collaborating more. So it's a model that came out of the UK, and basically the idea is that people are often going to the wrong door when it comes to accessing services. So they don't know, especially if it's the first time that you might have, say, needed to access, say, a food bank or something like that, you don't necessarily know where to go. And so people will often go to their first trusted source. And that's often a family physician, a nurse practitioner, emergency room, something like that. So they'll end up going to the doctor, and maybe it's a senior and their husband or wife has just died, and they're feeling lonely and isolated. And they go to the doctor because they're hoping to get some help, but you have to, it's really expensive, to sort of utilize an emergency room for that. And more importantly, I would say it's actually not going to provide the services that person actually needs. So what social prescription is, a really interesting model that basically says there is no wrong door, and we should leverage the kind of relationships that people have with the trusted folks in their lives to be able to provide them with the services they need. So that person, say again, who lost their loved one, is going in and would go in and say, hey, I'm having these problems. And that doctor would have a listing of programs that might be related to grief, right? And then would actually give a prescription to attend to grief counseling, or give a prescription for a food bank or something like that. So they would leverage that relationship in order to connect them, and then crucially follow them through that. So there would be a navigator, there would be a warm handoff to a social prescription navigator. That navigator would be kind of like a social worker, would work with them, would follow them, track them, make sure that they're getting what they need, might hook them up with a group where they can volunteer and co-create something themselves. So they might get involved in the creation of those pieces. But it provides those pathways and opportunities for someone to really sort of look at the whole picture and leverage the healthcare system to then sort of go out into the community and really collaborate more formally with those things. Because we've definitely seen that a lot of our nonprofits are doing that kind of referral work anyway. They're referring to each other. The gap is with that primary healthcare provider, right? And so what we're trying to do is we're trying to bring those pieces together and look at how we can pilot something like this in the community and see whether or not it's something that would be useful for people.
That's sorry, Daniel, that's
Okay.
I think it's important, because that's the biopsychosocial model of a person's well-being, right? Like the idea is supports can be accessed, that's biological, through medicine or doctors. It can be accessed through social, just like you're saying. Sometimes all you have to do is to go to grief counseling or go to a community center program, for example, right? The benefit of feeling a sense of community, feeling a sense of belonging, can provide coping strategies, can provide resiliency skills, can provide so many other skills that you didn't even realize you had, and that the ability for you to cope with whatever it is that you're experiencing, and obviously psychology, which is, the counseling component. Is there any uptake at all, Mike, with regards, is there a pilot that's starting that we should know about, that we can make, residents in Oakville aware about?
Yeah, so we're in the process right now. We were fortunate to get a little bit of Ontario Trillium Foundation dollars to explore this. So it's not a pilot so far, as it is really sort of like getting together some of the key decision makers to see what the appetite is. So we're really early in the exploratory phases, but we really like this model. We think that there's elements of it that are already going on. So one way or another, we see it as our role as conveners to sort of get something like this off of the ground. So we're hoping over the next year or so that we'll be able to be in a position to kind of put together essentially a pilot, a scoping project. Lots of interest. Like we've received, I think the first call out we did for the social prescription roundtable had over 100 people, 100 organizations represented that were interested in the model. So very, very high uptake. Our big piece now is then making those intentional connections to the hospitals and to the nurse and to the family health teams, and figuring out what a pilot would look like, so that we can begin to test out those pieces. Because there's technology elements, there's like cultural norms about how you make those things. Yep. There's training, there's all these different elements. And so, yeah, I mean, I think over the next year, our goal is to bring some kind of pilot to life in Halton and Hamilton.
So just to bring us to nearing our close here. So I really love the idea of social prescription, especially when we look at, so Nabeel, you and I from our lens in a recreation and culture department, and I know I've submitted this with your initial call out, Mike, is, obviously this is something that would have to go down the line, and Councillor Robertson, you would likely be involved in this decision-making process, but is there a way for those family health teams to prescribe someone, say, a fitness membership at one of your community centers? Because essentially the public dollars which we collect, I mean, I think 40% of all the dollars municipalities or local municipality spends traditionally comes back, or it comes through fees. However, 60% of our dollars are tax funded. Isn't it? It makes sense to defer, the benefit of folks getting healthy and staying fit before they have to enter more expensive interventions like healthcare, like mental health supports, which obviously, our $32 a month fitness membership for someone who's in desperate need of it is certainly more cost effective than, needing immense intervention through our public health sector. So no, I think that's really exciting. And I think if we can sort of build that collective understanding as a community that, dollars spent on a community level, are certainly, insurmountably more valuable than those spent on further interventions. But I want to get us to our very last question. And I'll take the first shot at it, Mike, and then you can fill in any areas, as the charitable sector does for the public sector continuously. You fill in anywhere where we're missing. So how can residents ensure that they're accessing every support available? So the first thing I would obviously encourage folks to do is I've written in the chat our link for our Halton Community Services database. You can just go online to Google, type in HIP info, Halton Community Services database. I would also sort of point to folks using 311, as I mentioned, and then as well as if you're starting to notice that simply accessing the services aren't enough, if you feel like you want to have a hand in changing services or making recommendations, understand who that intervention is required, like where that's necessary. So kind of building up from the bottom, like, so using Councillor Robertson as an example, if you're a resident in Ward 1 and you have significant change that you want to have in Ward 1 and it's at a municipal level, know who your local councillor is. Similarly, at the regional level, provincial level, and all the way up to federal level, there are folks that you're selecting and paying to make sure that they're advocating on behalf of your needs. So ensure that those needs are aligned with what you actually need. Apart from that, simply accessing the services, using 311, the web pages, and then trying to avoid your ability as a resident to not need emergency interventions, right? If you can get your needs met before you need to call 911 or some type of emergency intervention, that is a great role and responsibility for all residents and citizens. And then Mike, other than public services, man, how do people make sure they're getting everything they need?
Yeah, so I mean, I think like you said, 311, 211 is also another service that has actually been launched nationally now. So for the first time ever, 211 is a service available in every single community across the country. So this is similar to 311. This is a service navigator that will help you in 180 different languages at this point. So it doesn't matter what language you speak, you can access it. They will connect you to those things. There's also something that we've recently launched in partnership with Ample Labs called Chalmers. It's an AI-enabled chatbot that allows you to sort of like interact with it and ask for geographically specific information. So you could say, "I am hungry." It will know where you're located and tell you where there's food banks and other services around there. And then I think it's really important, we're coming to the end of the year. I think this is a time of the year when a lot of us are reflecting about what's important. It's been a tough year, 2020. Not the easiest year on record. And I think, if you were fortunate enough and you've been able to sort of, weather the storm, you still have your work, consider making that donation to, to your charity of choice, whether that's United Way or someone else, preferably the United Way. Because we are the ones who are going to be filling a lot of those gaps. And we are the ones who are going to be sort of, I think more than ever right now, the charities are looking ahead and saying, how are we going to weather this storm? Because not only are we faced with new expenses, the numbers are just keep going up. People are accessing services for the first time ever. And so they're interacting with those systems. So if you can, consider making that donation, and because the services are out there, and I am so proud of how deep the nonprofit sector is digging in to be able to make sure that nobody falls through the cracks.
Yeah.
Right.
And go ahead, Nabeel.
Yeah, no, I just wanted to point out, like we've mentioned many times, that people are reaching out for services, and the need is so much greater than it was before. I just want to ensure and highlight that there's no stigma to reaching out, especially if you haven't reached out in the past. That's what the whole point of today's conversation was, that this is what when we live in a in a community like we do in Canada and in Oakville. Like if someone's struggling in certain aspects of life, we're here to support that individual through, right? Whether that be a municipal service, whether that be a federal, provincial, or a nonprofit community-based service, right? This is the whole point of living collectively, living in a community. So should be no stigma or stereotype to reaching out for a level of support. If anything you can do that enhances your well-being, we want to make sure that we make it easy and accessible for you to do so.
Well said, Nabeel. I think for folks that are maybe finding themselves accessing public services or community services with United Way for the first time, just know that there's nothing to be ashamed of. Like we feel like we are very capable, and we are ready to help. Like we are all here just ready to ensure that you get the services that you need. No stigma, nothing to feel, any type of way about. Just let us know and we'd love to help. That is all for today's session. Thank you guys so much for being here. Mike, thank you for being here as our guest. Always a privilege to get access to your time for a little bit to always take away something that I've learned. So thank you, and all the best to everyone's families as they're watching this from home. And we'll see you next week, hopefully. Thanks, guys.